My name is Simapolo. Now, the UN AIDS data for 2020 shows that 1.7 million people acquired HIV in 2019, more than 3 times the 2020 target. The data also notes that adolescent girls and young women account for 1 in 4 HIV infections in sub-Saharan Africa. It is also stated that 690,000 lives were lost to HIV/AIDS-related illnesses in the same period, despite their variability of effective treatment. However, for the first time since 2000, the resources available for AIDS response globally declined. Yet, experts say that if the world is to be on track to end AIDS in 2030, there must be adequate financing towards this fight. With such disparities, the vision for zero discrimination, zero AIDS-related death, and zero HIV infections could be a distant dream. Now, this evening, I would like to bring in the expert to take us through these trends and probably see what we can do to this particular problem. This evening, we have Dr. Nelson Musoba. Dr. Nelson is the Director General, Uganda AIDS Commission, and he's a medical doctor with an experience of 20 years in clinical and public health. Dr. Musoba, you are live on Soul TV, and you're most welcome. We would want, first of all, to hear from you on these trends. What do you think? What is your opinion after, as we end 2020, we see that the targets that were set by the UN General Assembly, I think in 2015, could not be met or will not be met, and probably those that were set for 2030 are also a distant dream. Let's hear from you, Doctor.
Thank you very much, and good evening, our viewers. It's true, as has been observed, that globally we had set targets in 2016, what is popularly known as the 90-90-90 UNAIDS targets, meaning 90% of the people living with HIV testing and knowing their HIV status, and 90% of those who test positive are enrolled on treatment, and 90% of those who are on treatment adhere and achieve viral suppression. Now, for Uganda, we were not able to achieve the first 90. We missed it by 1 percentage point, but we achieved and surpassed the second 90, and we also achieved the third 90. We were among the 14 countries that, although did not achieve their targets, but did fairly well. Our target, for instance, for reducing new HIV infections by 2020 had been set to have them reduced by 75%. So we expected to have 18,000 new HIV infections in 1 year, but by end of 2019, we still had 53,000. So that is more than double the target that we had set. When you break that down, that's about 1,000 infections every week. That's quite still an acceptable number. And if you break that down still, you'll find that adolescent girls and young people between 15 and 24 take 3 times of the share of those new infections. So it is true that while in terms of effort we scaled up, we had a number of interventions, We had the Presidential Fast Track Initiative to End AIDS that was launched by His Excellency the President in June 2017. And there was a lot of, effort by cultural leaders, by religious leaders, appealing to people, to men. Men specifically had been, one of the groups that were not delaying to go for, and those who tested positive were not going for treatment because of stigma. And we had, efforts rallying champions, including the King of Uganda, His Majesty Ronald Mwenda Mutebi, coming out and messaging. And we were able to achieve the results we achieved. We think that we can do and increase our efforts. But that's where we've been as a country. That's how we were able to perform.
Musoba, of course, we heard of reports that probably we could see a reversal anytime after infections sometime back. The prevalence went high, and we used to see signs and warnings. Every time you would turn a corner, you'll see a sign warning you that AIDS kills. And of course, the campaign was intense in the 90s when we were actually rated as champions in this fight. But that is long gone. We no longer see that vigilance and intense campaigns towards the fight. What could have been the problem? Probably isn't it what has made us fail to hit the target?
Again, your observation is correct, that in the early 90s, especially when very few of our people could access antiretroviral therapy, we had an epidemic that was very aggressive. People would lose weight, and that's why it was called slim. They had open, skin conditions, opportunistic infections, cancers, and it was a very stigmatizing condition. Those were the times when, legends like the late Phile Bongole Lutaya came out and preached against the disease and told people to come out. And indeed, we saw that the infections came down. In the early 2000s, a lot of our people started accessing antiretroviral therapy. Medicines became available. People swallowed them. They started living longer. They started being more productive. And also the stigma and discrimination reduced. As we speak now, people living with HIV look, just like you and me. They are going around their normal duties. And it's possible that partly that led to complacency. A lot of the young people who were born in early 2000, who are in their 20s, who are 15 now, who have become sexually active, did not see the HIV that the older people, those of us, saw. And therefore, when you talk about the drum, when you talk about slim, when you talk about weight loss, it may not make a lot of meaning. So in terms of messaging, we've also tried to adopt a new strategy. We are working with young people themselves talking to each other. If you've been following, there is an organization of young people called UNIPA. It's young people living with HIV. They have come up with innovations like beauty pigeons. But basically, this is messaging to fellow young people, giving them hope, enabling them, first of all, sensitizing them that HIV is still there, and that there is no cure for HIV, and therefore that you have to be careful. But at the same time saying, if you've been unfortunate and acquired an HIV infection, either during birth from your parents or through a sexual act, it's not a death sentence. There is still hope. So being able to provide hope to others. So it's true that in terms of messaging, we've moved away from the drum, because also we've been testing messages with the young people. And clearly, using scaring messages may not work with them. That's what we found out. That scaring them, using the drum may not necessarily work. So instead, what works for them is listening to those who are close to them, either their parents, their peers, their friends, their guardians, telling them very clearly the causes of HIV, how it is transmitted, and how it can be prevented. And even that way, we think that we are beginning to see results being achieved.
All right, Dr. Nelson, I'm sure we can agree that the COVID pandemic affected or impacted almost everything, including the fight against HIV/AIDS. Could you please tell us briefly how the fight against HIV has been impacted by the COVID pandemic, briefly?
Yes, again, that is, your analysis is correct, that when COVID came, the immediate reaction from our leadership was to protect Ugandans from getting infected with COVID. And so public transport was closed, there was a lockdown, but that lockdown had, a negative impact. It meant that people living with HIV could not easily go to the health facilities to get their medical refills. They could not go for testing. If those who were supposed to get counseling services couldn't travel to receive them. Although government later on, put in place measures to ensure that people seeking health and HIV services were prioritized, that they would get permission, from the leaders, the local leaders, and the RDCs to be able to access health facilities. But we also know there's a lot of stigma around living with HIV, because getting permission meant going to say the reason why you would like to get the permission to travel. And again, that working with the networks of people living with HIV, a bit of that stigma was dealt with. But the other negative impact that resulted from the COVID lockdown was food. People's livelihoods were affected, and it meant that, access to food became a problem. And when you are on antiretroviral therapy, you need to have your meals in a timely manner. So people's treatment and adherence was impacted, because when they missed their meals, they also missed their medication. Although, again, working with the district task forces and the national task force, this is another group of people who are prioritized during the food distribution. So we will analyze the impact of the HIV numbers at the close of this year and tell whether indeed we had HIV positive cases increase or reduce, and whether the AIDS-related deaths also increase. The exact statistics we will be able to tell, but generally in terms of processes, that is how COVID impacted on the HIV response. Doctor,
at the advent of the COVID pandemic, did you have a plan for, to ensure that the processes in the fight would remain steadfast? Did we have a plan, or did a plan, was a plan designed or developed along the way anyway?
Of course, when COVID first came, none of us knew the magnitude and how it was, in which direction it was going to move. But as soon as we saw it, how it was moving in other countries, the Ministry of Health put in place guidelines, a guideline on how HIV services would be accessed, how HIV prevention, would be in place, instructing health workers on how, to approach this, because we also knew service delivery would be affected, putting in place special, requirements and permissions for travel for special categories of people, including implementing partners. So although initially it wasn't clear which direction and magnitude, COVID was going to take, we quickly put in place a plan. Ministry of Health did that. We issued an advisory as Uganda AIDS Commission. We were working with the National Forum of People Living with HIV. We worked with the National COVID Task Force. We linked to the district task forces, and we ensured that we minimize the impact, the negative impact of COVID as much as possible.
A key component in this fight, I'm talking about funding. How has it been? I mean, funding the fight, mainly lately after the COVID pandemic broke out.
Even before the COVID pandemic breakout, HIV funding has been predominantly donor funded. They fund, up to between 70 to 80% of the requirements. Although over the last 3-4 years, government has been incrementally increasing the funding. This last financial year, government doubled its contribution to antiretroviral therapy to the tune of $50 million every year. But HIV remained predominantly donor funded. Of course, when COVID came, as a country, you saw the prioritization was towards COVID services to make sure that the testing is in place, that the personal protective equipment in place, that we had functional ICUs installed, that timely communication goes out to the population, and all that requires and costs lots of money. So it meant that certain services, of course, the planning, the minimum was maintained. For instance, money wasn't taken away from ARVs, money wasn't taken away from testing, but some of the areas that we would allocate resources to, like communication, like messaging, those we made sure that they are integrated, and the platforms that were being used can go for both HIV and COVID-19. And clearly, COVID-19 was prioritized because it was seen as an immediate threat to life because of the methods in which it was presenting. And it's now that we are making sure we are sending out a message that even with COVID, we need to make sure that at the end of the day, when we've defeated it, we don't wake up and find that HIV has increased and gone through the roof. So that's why we are maintaining the fight, we are maintaining the messaging. We want to ensure that even as we fight COVID, we do not forget other public health diseases of importance, and HIV and AIDS is one of them.
Doctor, as we conclude, I am sure we have a law that was that was worked out to, of course, help in this fight. I'm talking about the HIV/AIDS Prevention and Control Act of 2014, which also provides for a fund.
Yes.
What happened to that fund in just 1 minute?
Well, again, you're right that the HIV Prevention and Control Act 2014 provides for, among other things, the establishment of the AIDS Trust Fund, where a deduction of a levy on taxes for soft drinks and other drinks is levied and put into a pot, and then it would go towards antiretroviral therapy and HIV counseling and testing. After that law had been passed, regulations were also prepared, and the Minister of Health is supposed to follow up with the Minister of Finance to ensure that this gets operationalized. I know that this financial year, the Speaker of Parliament authorized the Minister of Finance or ordered them to ensure that this account becomes operational, and we are hopeful that if this gets established, it will provide another additional source of funding to go towards contributing to the antiretroviral therapy and HIV counseling and testing, among other interventions.
It is true, 6 years down the road, the law is not operational. Which law could have helped in this fight against HIV/AIDS? And finally, as we wind up, your message as we move to the AIDS Day on December 1st.
Thank you. So this year again, we will commemorate the International World AIDS Day. It will be a scientific event, and the theme, the national theme, is national solidarity and shared responsibility towards ending AIDS. And my message to Ugandans is that First of all, a message on stigma. Let's not stigmatize people living with HIV. We should support them. We should encourage them to continue their medication. Let our leaders continue to give out a positive message, encourage people to go and seek services. The young women who are either pregnant or planning to get pregnant should test and know their status. And if they are HIV positive, then they should be started on antiretroviral therapy so that they can have, a safe pregnancy and deliver an HIV negative baby. The young people out there, I know that young people have dreams. You'd like to realize, all of you have dreams, and you'd like to realize your dreams. And you'll only realize these dreams when you are alive. So protect yourself. Until you're sexually active, abstain from sex. When you grow up, become an adult, and you're sexually active, be faithful to your partner. And should either your partner is discordant or you do not know the HIV status of your partner, then you can use a condom consistently and safely. But do not succumb to peer pressure. Keep away from drugs and alcohol, because this can influence you to make the wrong decisions. Because again, only when you are alive will you be able to